Hello, my name is Dr. Roman, and today let's discuss moderate IV sedation. So what is moderate IV sedation? It's the form of sedation that we do through an IV that we place into your vein, and through that portal, we are going to inject some medications. Now, these medications, they're a little bit more potent than just having you take a pill or having you have nitrous oxide or laughing gas. And usually the response that I get from patients is that they don't remember anything, and they say, I went to sleep and I only woke up at home. And that's the beauty of moderate IV sedation. We make sure that the new memories are suppressed, you don't remember anything, and you're relaxed during the entire procedure and not nervous. And the best part of it, you don't remember what happened during the procedure because we don't want you to have to deal with all of this dentistry, especially when you're nervous. However, during this moderate IV sedation, what you're not aware of is that you're actually responsive. So if I say, my friend, could you take a breath for me? Or could you look at me? Yes, the patient will kind of open their eyes, look at me, and go right back to being relaxed. So this is the beauty of moderate IV sedation. We don't put you into general anesthesia. You still have control over your breathing, coughing, sneezing if you have to even. Or if something's bothering you, you will actively tell me. But the nice part is that you will never remember that, and it'll feel like you were asleep through the entire thing. So yes, your body is responsive, but your consciousness is not present anymore. And that's what makes it moderate IV sedation. It's more sedation that you get out of laughing gas or a sedative pill that sometimes dentists prescribe. Will you be asleep? To you, it will feel like you're asleep. So when the medication wears off, you will feel like you have woken up and you have no memories of what just happened. But your body will still be able to carry on its functions as usual. So you'll be able to breathe on your own, cough on your own, and if you need to talk, you will be able to talk on your own. So sometimes even I ask my patients, hey, are you doing okay? And they'll give me a quick nod and we'll continue the procedure. But when the medications wear off and I ask them, do you remember anything? Do you remember being uncomfortable? Oftentimes they tell me, I have no idea what happened. I just remember you put me to sleep and that was it. In my opinion, an ideal form of sedation, because I don't need to worry about are you breathing or you're not. You are breathing on your own. You are coughing on your own if something goes down your throat, like a little bit of water or spit. But if you need to cough or you need to readjust yourself, you have full capability of doing that, and your body will take care of that. All I have to do is make sure that you're out of pain and comfortable. Will you remember the procedure? Not at all. Sometimes towards the end of the procedure, when medications are wearing off, people start to be a little bit more lucid and they remember waking up in the chair, but usually we are done at that point and they're just kind of waking up already being seated. And I have a short conversation, make sure they can answer my questions, and they're well awake enough in order to be dismissed from the clinic. Is IV sedation safer than oral sedation? So let's go over what oral sedation is. Sometimes you go to a dentist and they give you a sedative pill. They prescribe something, you take it an hour before, and then you have kind of a relaxing effect that you can enjoy while you are having your dentistry done. In those instances, that particular pill can have mixed results. Some people remember the procedure, some people do not remember the procedure. Some people say, oh, it feels like a glass of wine, but that's it. Some people feel like, oh my goodness, I just knocked out and I was asleep the whole time. The oral sedation has these mixed effects where you can't control them very well. So you don't know whether you're going to get a good sedation or maybe not enough sedation. The IV sedation helps us moderate because we have access to your circulatory system, which is we put an IV catheter right into your vein and we know exactly how much we're giving you and we know exactly how much is hitting your brain. So we know that we can dose it to perfection so you have a great sedation every single time. But also because I can modulate the drugs that are hitting your bloodstream on minute-by-minute basis, I can also issue reversal agents. Like for example, let's say I have given you a drug and you're sedated. And for some reason, I decide that you're a little bit too much sedated, or we have finished our procedure early and I need to cut my sedation short. Just because I have access to your bloodstream, I can give you some reversal agents and we can cut the sedation shorter and having you wake up faster and kind of come to a little bit quicker than if you have taken an oral sedative. So what IV sedation does, it gives me more control over sedation to get it just right for you so you don't feel like you're under sedated. But I have control also to cut the sedation short or get you out of sedation if it, for example, becomes deeper than we want it to, or we want to end sedation procedures faster than we initially intended. So is this moderate IV sedation same as general anesthesia? Not at all. General anesthesia is great because you're getting your oxygen right through a tube that goes into your lungs. The anesthesiologist doesn't worry if something goes down your throat. That is the safety margin of that particular anesthesia. But typically when you go under, that's for a far more serious procedure than just dentistry. In dentistry, typical length of a procedure is 2, 3, maximum 4 hours, and we really don't need you to be generally anesthetized for that short of a period of time. We can make do just fine with IV sedation, and that way there's no lasting effects, there's less complications on our end, and you end up being happier and having a better experience. Do you still need to be numbed even though you're IV sedated? Absolutely. In any sort of procedure, unless it's general anesthesia, we are going to numb your tissues. Because yes, even though you are relaxed and you are sleeping, your tissues can feel things and they can still bleed. And oftentimes what we use our anesthetics for is to make sure that your brain doesn't register any pain, but also to control any minor bleeding that's happening during the surgery or whatever procedure we're carrying out. So yes, we are numbing even though you're sedated and you won't remember anything, but we still want to numb everything just to make sure that we're controlling the tissue bleeds and controlling pain once you are out of sedation. So yes, you will be numbed even though you are sedated. What procedures do we use IV sedations for? 100% wisdom teeth. Even though some people come to my practice and they say, I don't think I need IV sedation. And fair enough, we can do it without IV sedation. But we always recommend to do IV sedations because for wisdom teeth, it's a little bit more of a involved process, and not everybody wants to be around for when that happens. Other things such as implants or implant bridges or big bone grafts, when people don't generally feel like they want to witness the whole thing in their mouth, I suggest getting IV sedated, and that way you don't have to remember and worry about what's happening to you. The best thing is you go to sleep, and when you wake up, you know everything is done, and you're just on your way to recovery. How do we monitor IV sedation? Just like in any other sedation, we put some heart monitors on you, we put a breathing tube on you just to make sure that you're breathing. And it's not a breathing tube that goes down your throat, it's a nasal cannula that goes kind of across your face here so we can measure as you're breathing in and breathing out. Also, we use a pulse oximeter right on your finger just to know that whatever oxygen that you are receiving in into your lungs is enough to supply your blood system. So that way we know that you are breathing, you're oxygenated, and you're circulating fine, and your heart is doing okay. Those 4 things is what I want to know to do a safe IV sedation procedure. And anytime those 4 are present, I have a peace of mind that everything's going to be fine, and you're going to have an excellent experience here at Pacific Park Family Dental. Can I drive myself home after this procedure? Absolutely not. You need somebody to pick you up. Even though, let's say you got yourself here on your own car or public transit or whatever, we do want someone to come and pick you up because oftentimes people don't even remember getting home, even though somebody has driven them home. So for IV sedation, who is generally not a good candidate? We have sedated a lot of people with very difficult medical histories. So not many people are poor candidates. Almost everyone can have IV sedation. However, if you are having history of COPD or complications with lungs, or you generally have a history of difficult anesthesias and sedations, at that moment, yes, we would call an anesthesiologist into our practice. But generally speaking, almost everyone that I worked on, even with difficult medical histories, had no problem getting sedated, and we always have fantastic results. So again, this is Dr. Roman, and we were discussing moderate IV sedation and how it's done at Pacific Park Family Dental. If you have any more questions or you want to speak directly to me or address some concerns that you may have, please give us a call and we will be happy to see you. Thank you.